Health anxiety can be this incredibly frustrating loop for everyone involved. The patient feels like nobody's listening, and the clinician can feel totally stuck. But what if the way out of that loop isn't another test? What if it's just a better conversation? We're going to walk through how to have that conversation, a compassionate guide for healthcare pros to turn these really tough interactions into a real path toward healing.
It all starts right here, with empathy. A sentence as simple as this one can change the entire tone. It tells the patient, I see you. I hear how hard this has been. It validates their journey right from the get-go. This isn't about dismissing their fears, it's about starting a partnership from the very first moment.
So that's the big question, right? How do we actually get from that endless cycle of tests and reassurance that never lasts to a real collaborative plan that builds trust and resilience? Well, we're going to break it down into 3 parts: the mindset you need, the framework for communication, and the plan for following through.
All right, first things first. Before we even think about the specific words to use, we have to start with a huge shift in perspective. And this isn't just about tweaking our approach, it's about fundamentally changing the goal of the entire conversation.
Check this out. The old goal, trying to hunt down and eliminate every single symptom, it's often a wild goose chase. And honestly, it just makes the anxiety worse. But the new goal, now this is a game changer. It's about helping the person get back to living their life, fully and meaningfully, even with those physical sensations. It's about building resilience, not just chasing ghosts.
And this part is absolutely non-negotiable. The feelings are real. The chest tightness is real. The dizziness is real. Period. The conversation has to start there, on that common ground. The point isn't to debate whether the feeling is real, but to get curious about its source, framing it as this fascinating connection between our minds and our bodies.
Here's another really powerful tool for building that trust. It's called the one-down position. And it sounds counterintuitive, but instead of being the all-knowing expert, the clinician chose a little humility, admitting that, medicine doesn't have an answer for everything. It's amazing how this actually makes you more credible. It changes the whole dynamic from a lecture to a partnership, sending the message, hey, we're in this together.
Okay, so we've got the new mindset. Now, how does that translate into what we actually say? The key is explaining what's happening in the body in a way that's clear and believable, but, and this is crucial, doesn't add more fear to the fire. And the best way to do that is often with some really good analogies.
I love this one, the smoke alarm analogy. It's just perfect. You explain that their nervous system is like a super sensitive smoke alarm. It's not broken, it's just going off like crazy over a piece of burnt toast, not just a 5-alarm fire. Right away, this helps the patient see that their body isn't failing them. Its alarm system just needs a little recalibration.
And here's another great one, the car engine. This one is perfect for explaining those physical symptoms like a racing heart or tense muscles. You can say, it's like your body's engine is idling way too high. It's constantly redlining. See the theme here? The engine isn't broken or damaged. The goal isn't to fix it. It's just to help it learn how to slow down and get back to a normal idle.
The words we choose have so much power. Using terms like functional symptoms or a body-mind interaction keeps the conversation open and focused on something that can be managed. But older, loaded terms like psychosomatic, man, those words can feel so dismissive. They just shut the conversation down and break any trust you've built. And this isn't just about being politically correct, it's about being effective.
All right, so you've shifted the mindset, you've found a shared language, but how do you make it stick? The secret is to move away from just reacting to every flare-up and toward a proactive, predictable plan that gives the patient a real sense of safety and structure.
This gets to what's called the Reassurance Paradox. Just saying, don't worry, all your tests are normal, gives this tiny, fleeting moment of relief. It's like a sugar high. It feels good for a second, but then it wears off and the patient is back for another fix. A much better approach is to acknowledge that. You validate the relief, but then you immediately pivot the conversation to the real issue, the underlying pattern of worry itself.
So you make this concrete by creating something called a care threshold plan, and you do it together. It's basically the rules of engagement. Step 1, you clearly define which symptoms are okay and don't need a call. Step 2, you set up a waiting period for new, non-alarming feelings. And step 3, which is super important, you identify the actual red flags that absolutely do need a consultation. This is so empowering because it hands a sense of control back to the patient.
Now this is absolutely critical. If one doctor is using this validating, structured approach, but then a specialist or a doctor on call goes right back to offering endless tests and temporary reassurance, the whole thing falls apart. It completely undermines all the progress. The entire team, from the person at the front desk to the primary physician, has to be on the same page, reinforcing the exact same message.
So let's pull all of this together. Why is this kind of structured, compassionate approach such a game changer? Well, it's because it doesn't just tweak the conversation, it fundamentally shifts the entire dynamic of care.
And here it is, all laid out in one place. Think of it as a handy little cheat sheet. You can see how each principle we talked about, from validation to setting boundaries, connects directly to a practical strategy, and even gives you an example of something you can actually say. It's a step-by-step toolkit for building a much, much better conversation.
And that really brings us to the heart of it all. At the end of the day, the goal here isn't to win an argument or to prove that nothing is wrong. The real job is to be a guide, someone who helps the patient move from a place of fear back to a place of trust. Trust that their body isn't broken, trust that their care team is a true partner, and most importantly, trust in their own ability to navigate this and get back to living a meaningful life.